everyone, and welcome back to another episode of Making a Difference in Mental Health. I'm your host, Danielle.
I'm your co-host, Wendy. Great to have everybody here. So today's special, Danielle.
Yes.
Why is it special?
Well, this is our first live guest. We're
Absolutely.
excited.
We're live in our podcast studio right now, and we have our first guest, and we're so excited to welcome Mr. Udoka. He's going to introduce himself, but today's topic is going to be men and depression.
Okay, how's everybody doing? My name is Udoka Ahagotu. I'm a clinician here at Advanced Behavioral Health in the Greenbelt office. How I came to the Greenbelt office is a long story. So for going on maybe 10 to 13 years now, I've been working with kids and teens in some capacity. I first started off working as a camp counselor, transitioned to working as a camp director, did sports programming, did mentorship programs, and then eventually transitioned to working with kids with developmental disorders in a ABA clinic. So transitioning into the mental health space as a clinician came very, very natural for me. I first was given this internship to intern with Advanced Behavioral Health, and then I transitioned to working here, and I'm now going on a year and a half. Yeah.
Good.
Congratulations. So, Udoka, we're going to get right into it. We're going to talk about men in depression. So, you guys are aware of, what happened most recently with a very prolific African American entertainer, Steven, aka Twitch Boss, who suddenly took his own life. It was really shocking to the entertainment world, fans around the world, etc. He was known for being a judge on So You Think You Can Dance. I think he in season was a runner-up in 2008 in season So You Think You Can Dance, and most famously was Ellen DeGeneres' DJ. So if anybody's ever watched the Ellen show, you know how Ellen rocked in the beginning of the show. So this was a very profound loss. And I was doing some research, and I was looking at some of the things that people are now kind of labeling this as, what do they call it? A high functioning depression. So it's basically people who are carrying all sorts of things with them, the weight of the world on their shoulders, but yet performing and yet responding to the public and to their jobs. And people have absolutely no idea what they're carrying. And so you all, as mental health professionals, know that that's like a pervasive depressive disorder, like dysthymia. That's what we kind of call it in our terminology in the world of mental health. But what are your thoughts about that? It's such pressure, not only on women, but men to just be okay. What do you think?
I think we know, especially from working in this space, is that people oftentimes suffer in silence. When I think about the concept of high functioning depression, it's this internal state where you are experiencing depressive symptoms. Some of the common symptoms like loss of interest in certain activities, isolation, loss of appetite, but you're able to function in typical spaces like your workspace. You're able to do what you need to do. Maybe in your home space, you're able to do what you need to do, but internally, you're suffering. For it to be considered high functioning, to me, I may have a little bit of concern with that title.
Right. It's, it's the entertainers coming up with something like that. Everybody always comes up with like a slang term. But yes, I don't know if it's really high functioning, but
Yeah. And I think one of my challenges around that is that we don't want to label or talk about that disorder in a way where it's something that doesn't need to be addressed, that doesn't require some level of concern. So when I hear the word high functioning, I have a little bit of concern around that. But I will say from the perspective of being a man, especially one being a Black man in this space, I even take pride in attending to certain responsibilities. I think for me, just as anyone, you take a lot of pride in what you do. I think anybody does that, but I think based off of the way men are socialized in this world, we might even take an increased pride to it.
I don't mean to interrupt. Well, actually, I want to pause for a second because you're bringing up a lot of good points. When you say increased pride, are you saying increased pride in suppressing and showing strength, are you saying an increased pride in being able to express, hey, I'm not feeling well. I'd like to talk to someone. I'm actually feeling these emotions that include depression, or that include like a withdrawal or an isolation, or I'm just not feeling myself. So for our audience, which one are you speaking of?
So what I'm speaking to is just an increased pride to one, provide, and an increased pride to succeed, to do
Okay.
well in certain spaces.
hmm
So I can understand how if you're dealing with depressive symptoms, there's an increased need to suppress that, to make sure that you're consistent
hmm
in making sure that you're doing well in your workspace and providing for your family.
Right. And I think, before you're actually touching on like some of the things that we want to talk about next, but I know that even in season 1 and season 2, we had a panel of men that we spoke to. We even featured fathers, and they were
Part of the
advanced
family.
behavioral health. And, I always have this thought in my mind. Women, we get a little away with a little bit more of being emotional, being able to express our thoughts, our feelings, everything from feeling excited to nervous to scared to angry to depressed to sad to, I just want to be left alone. And, oftentimes I say there's such a spectrum of emotions, but I feel, and this is just from the outside looking in, the perspective of men and then men of color, that you can dwell in two spaces. You can be chill and calm and relaxed and just the easygoing guy, or we have that stereotype of just like an angry black woman, a mad or angry black man. And so this space in which there's this spectrum of feelings, you're not allowed to at least publicly explore. And then oftentimes you're left alone to your own devices, and then publicly we hear about the demise, such as Twitch. So, that's kind of my thought. But you also bring up a good point where we were going to move to next about being, a man in America, and then also being a man of color. And then, are there any platforms that men of color can explore when they're experiencing what you've been talking
So as far as platforms, I know that I've even seen an ad for Talkspace where it says tough guys go to therapy.
about? Okay.
I think I've seen that.
Yeah. And I think that's a great space because within the Talkspace space, you're able to, honestly, it's almost like a search engine for different types of therapists.
hmm
You can tailor your therapist based off of race, based off of age, based off of specialization. So it allows you to find a therapist that take on more of a generalist approach. So I think that's a really great platform. And then I would also say, just in general, look into your local clinic, look into your local mental health clinic. When it comes to looking for a space as far as your mental health needs, you don't have to go with the very first person that you find.
hmm
That's important. Say that again.
You don't have to go with the very first person that you find. And I can even say from personal experience, I've been guilty of that and didn't have the best interaction with a therapist. But I will tell you from working in this space, rapport is everything. Rapport is everything. So make sure that you find somebody that you're comfortable with. And if it takes time for you to do that, don't give up.
hmm And I like how you mentioned about, the first one doesn't have to be the one.
Absolutely.
You can, tailor and curate your therapeutic life, like, your self care and your wellness and well being for your emotional health, with being able to say, hey, this doesn't suit me, this doesn't fit me. Thank you for your service, thank you for your work. And I'm sure that we've all, at some point in time, as therapists, have experienced that as well, where maybe a client isn't the best fit. And I'll also say too, there does come a certain point in time where I have had male clients and clients of color as well. At a certain point, I know, and we come to a decision that I might not be the best service for them, because at a certain point, for me, I don't have certain male experiences, or experiences as I identify as a woman, I might not have those experiences. And it might be best then to consider, other options and other supports in the person of a, male therapist or someone that best fits. So yeah.
Absolutely.
And I think as a clinician, that's important to check in on that as well. And I liked what you said about like these engines or search engines or these platforms like Talkspace, because it gives men a more confident, more confidential kind of pathway to try to get their help. without, women were just like, I need a therapist, I'm going.
But we have that option too.
Right.
Like we're able to freely say, and I think that that's an
And
advantage.
it's accepted,
It's
right?
acceptable in society. Back in the day, we were considered hysterical if we didn't
Right.
have it.
Right.
So
right.
but opening the space even for this conversation, I just think helps our audience, and helps you. It might help other males that are watching this
To just
today.
go for it. So, Doka, in your experience and in your practice, what have you seen as a clinician when you're dealing with the young boys, older men? What is your sense? Are we turning the corner on this subject? Are we getting more men and younger boys to buy into the fact that you're not weak if you go
Mm-hmm.
That's a great question. As far as turning the corner, maybe very gradually, maybe we're looking at the corner.
Uh-huh.
Don't know if we're really turning the
I
corner.
remember something like that last season. We kind of said that too.
Yeah.
Like it's like we're adjacent to it, or it's almost there.
You can see it.
Yeah.
But no, I don't think we're at a place where we're turning the corner.
Okay.
But there are two things that I see in terms of presentation of young men and just men in general as far as therapy. There are men who present the general symptoms, isolation, loss of appetite, loss of interest in previous activities. And then there are men who look for ways to distract themselves. And I've had
Yes.
conversations where there are men who are trying to work themselves to the bone and work themselves to the bone until there's some form of crisis. And then they're coming into therapy.
Because they didn't want to deal with it.
Absolutely. Yeah. And I think distraction can be a very beautiful tool. It can be a really, really good coping mechanism.
Like ignorance is bliss.
Ignorance is bliss, right?
Sometimes it's good.
But there are times where it can be very maladaptive, right? If something occurred or you're starting to experience symptoms that are very noticeable, you can't distract yourself to make those things go away. So in terms of general presentation, that's personally what I've seen.
I mean, everything that you're saying, I'm picking up on. It's really good to have a different perspective too, because sometimes you might wonder, what caused you to wait this long to receive services? But then again, socially, how acceptable is it for a guy to say, hey, I need to go to therapy if they're feeling a certain way, when their buddies or their dad or, a figure in their life who is strong, who is stoic, who, over time, we've been conditioned to just be strong. Boys don't cry, right?
Right.
At a certain point, you wonder sometimes as a therapist, wow, how did you get this far? But then when you think about all of the things that you've kind of gone over today, it makes sense. And like you said, we haven't turned the corner yet, but platforms that we've spoken about so far, and even you being here today, opens up the conversation.
And put the spotlight on it, that it's important, and that we're pushing toward making the corner.
Agreed.
Yeah. Are there any other stigmas that you can think of that men, might that might be around, but that you can share when it comes to seeking mental health?
Sure, I can think of a few. So I think one major thing is sometimes there might be a fear, or better, let me rephrase this. I think with social media, unfortunately, there is the issue of comparison. With social media being around, it's almost automatic. I know some of us might. The first thing we do in the morning is to look at our phones, and there is this narrative of men having to be very strong and having to be very stoic. And I can even say from speaking to men, especially older gentlemen,
Yes.
there has been, a lot of them were raised based off of survival. So that need to push through those hard times, to push through those periods where they weren't feeling well, was something that they had to do. And I think a lot of us were raised in that same way. So, when we have conversations with people that are older than us, our fathers, our grandparents, that is the conversation that they're having with us. And sometimes there's not as much support for mental health treatment. And I think there's also a general fear of it potentially slowing us down. I said earlier that as a man, I think there is a high need for us to be successful and to, attain as many things as we can and provide. And I think that's a general thing that everybody wants to do. But I do think in a certain way we're socialized to do that maybe a little bit more. And
Men
sometimes,
are wired.
Yeah,
Yes, absolutely.
yeah. I again, all of this conversation is bringing up a lot of what we talk about it, but it only just kind of reinforces the need. So from time to time, I'll tell this quick story about how little girls, when we're born, we have a doll in our crib, and we're already conditioned and socialized from age 2. We have a tea set, we have a kitchen set, we have dolls, and we're dressed up, and we pretend to get married, and all of these things that happen along the way of development. And what I've seen, I'll just say in my own experience with, like, say, my brothers or my dad. My dad is part of that generation that's stoic, that you tough it out, for a little while, you baby the boys, and then you send them outside to play. And then at 18, you ask them to come back inside, and they have to figure it all out. You have to work, you have to do these things. Whereas girls, we're able to go through those emotions. So from the time of, being able to talk to that 18 period of time, there's such a opportunity here, to nurture those emotions for a healthy way. Like you said, some stress or some distraction is good, but in a healthy way, to be able to express thoughts, feelings, emotions without being, condemned for being emotional.
Right.
You know,
And having to work so hard to hide it from
That's it.
everyone.
That's
I think
it.
that's what people struggle with. I have to maintain this aura, and I have to work so hard not to let people see how I really feel inside, or what I'm really kind of going through. And that's exhausting. Right? I think we all agree on that.
I totally agree with that.
Absolutely.
Yeah.
So, Udoka, before we're wrapping up, when we have our guests, we always like to leave our audience with some good tips and ideas and things to just kind of keep in mind. And since we're talking about such an important topic, and continually shining a light on it to get people to embrace that, getting help doesn't make you weak. What would some tips you would share with men about young men, boys seeking mental health treatment?
Okay, so I think I would reiterate what I said earlier. Go and seek a therapist. It is confidential. If you go and seek a therapist and it doesn't work out the first time, the second time, keep trying until you find somebody that's that match for you. You need to be comfortable in that space. And then I've also seen some challenges around disclosure. There may be times where you think that what you're experiencing is too deep for you to go to therapy. I will say from my experience that even just a little bit of disclosure can be very beneficial within a therapeutic setting. So you can even do consultations with therapists, talk about just generally what you want to talk about, and see if that person can help service you. There's also a point that I made just a moment ago about feeling like therapy might slow you down. Feeling like if you address those issues, it might take away from your time that you're putting towards your career or just some of your personal goals. From my perspective, I like to think that therapy makes you faster. I will tell you from my personal experience from going to therapy, like, it allows you to be more present in things that you enjoy. It allows you to be more attentive within your workspace, because when you have an ability to talk about those things that you've been holding on for a long period of time, and when you have the ability to learn those coping skills, it makes life a lot easier.
So say that tagline again.
Therapy
Oh,
makes you
therapy
faster.
makes you faster.
Yes, that's
Yeah.
good. I like
You gotta
that.
copyright that.
I like that. Yeah. You heard it here first.
You heard it here,
makes you
audience.
faster.
Therapy makes you faster and more successful. All right, well, Udoka, thanks so much
Thank
for
you.
coming into our podcast today in our studio and sharing your thoughts about men and depression.
Sure.
Hopefully, you hit some nerves in the audience, and they're soaking it all in and saying, yeah, I need to.
Right.
Need to.
Right. So be sure to like, comment, share, and subscribe. We thank you so much again. I know him as Mr. You, everybody. So we thank you so much for coming into our studio and being our first live guest.
Very much. Thank you for having me.
Yeah,
Thank
you're
you.
welcome.
Quite
You're so
welcome.
welcome. And hey, we might call you back.
Yeah,
we might call you back.
Time coming.
This is
Right,
really
right.
cool.
Yes, they
So,
love to come back.
Yes, we might call you back. So again, this is another wrap of a good episode. My name is Danielle.
I am Wendy.
This is Making a Difference in Mental Health, where we're always striving to make a difference in mental health. We'll see you next time.
Take care. Bye.